This is Dr. Marty Klein with more sexual intelligence. Today I want to talk about sexual options that many people don't use. Now, it's true, many of our sexual rights have been eroded in the last 10 years, and school sex education is the least accurate and most harmful it's been in decades. Laws regulating pornography, live entertainment, reproductive rights, and coerced speech by physicians and psychologists will become even more common in the next 4 years. That said, I invite us to be thankful for the sexual freedoms, technologies, and options we do have right now. Here are some that many people don't take full advantage of, and I encourage you to do so. The first is emergency contraception. The morning after pill prevents pregnancy by preventing or delaying ovulation. If you don't ovulate, you can't get pregnant. The morning after pill will not end a pregnancy that has already begun. There's absolutely nothing that anyone can say, no matter how passionate they are, that contradicts this simple fact. Emergency contraception cannot create an abortion. It can only prevent a pregnancy. There are now several different kinds of emergency contraception. One requires a prescription, but the others are available over the counter at drugstores and chains in virtually every city in America, at least for now. This product, with brand names like Plan B, My Choice, and Aftera, is a modern miracle, effective as much as 98% of the time if it's taken soon enough. Why, oh why, oh why doesn't every fertile, sexually active American of any gender have this product in their medicine chest? It's inexpensive and it lasts for 5 years. After that, if you don't need it, celebrate that you didn't need it and replace it with a fresh package. The second product is lubricants. Now, after 44 years as a sex therapist, very little surprises me anymore, but I'm still amazed at the number of people who don't use lube when they masturbate or have partner sex. I still see women who are insulted when I suggest lube for intercourse. I get plenty wet, they often say indignantly. I get aroused. I'm not old. And when I suggest lube to men who have trouble entering a vagina or an anus, or whose erections are wobbly when they're alone or with a partner, they respond as if I've accused them of being inept. Yeah, stop everything and reach for lube, right? A patient will occasionally sneer, as if I'm suggesting they reach for a diesel generator or an entire WNBA team. But we don't use lube to solve a problem or address a failure. We use lube to make sex more enjoyable, with or without a partner. If you keep it handy where you usually have partner sex or masturbate, reaching for it can be simple and non-intrusive. Lube is better than spit, which quickly disappears when it's absorbed, and it's better than olive oil or any other kind of oil, which are difficult to get out of a vagina or an anus when you're done. Many brands of lube are available in every drugstore, typically near the condoms or tampons. Amazon carries over 100 brands. The easiest kind to use, and these are mandatory with condoms, are the water-soluble brands. A tip for condom users: put 2 drops inside the condom to increase heat transfer and make the condom stick better to a penis. Now, the third is pelvic floor therapy. Pelvic floor therapy is a kind of physical therapy that helps rehabilitate the muscles around the pelvis. Women and men are typically referred to it for painful sex or orgasm, postpartum issues, pelvic organ prolapse, hemorrhoids, and incontinence. In addition to treating chronically tight muscles, the therapist can teach exercises to strengthen and relax pelvic muscles. Pelvic floor therapy is one of those treatments after which people say, I feel so much better, and I didn't even realize how tight and sore I actually was until we fixed it. If sex or orgasm hurt, or you have other pelvic issues that your physician can't explain or resolve, get a referral to one of these fabulous practitioners. Number 4, hormone replacement therapy. You know, the more we know about estrogen replacement for middle-aged women, the better it looks. And with 2 million women entering menopause every year, the late 40s, a year or two before they begin, is a special window when women can use estrogen to protect themselves against problems including dementia, heart disease, and osteoporosis. But wait, isn't estrogen dangerous? Doesn't it cause breast cancer? In a word, no. That myth became widespread overnight in 2002 from methodological mistakes in one single report. Subsequent studies around the world have convincingly demolished this myth. But no actual problem never gets the headlines that, wow, huge problem gets. So millions of women and their doctors still believe that estrogen is dangerous. The best book on this subject is Estrogen Matters by Blooming and Tavris. It has just been updated and is a fascinating, uplifting, and totally useful book. And the last thing I want to mention is sex therapy. The sex therapy field was formalized by Masters and Johnson some 60 years ago. Usually offered by a psychologist or marriage and family therapist, sex therapy is sometimes done by a nurse, nurse practitioner, social worker, or psychiatrist. Sex therapists treat problems with erection, orgasm, and desire, as well as guilt, shame, and anxiety. We also help individuals and couples think and talk about infidelity, non-monogamy, BDSM, sexual orientation and identity, pornography, and past trauma. There are several thousand experienced therapists, sex therapists in the US, at least a few in every medium and large city. And now with Zoom sessions, almost anyone can meet with a sex therapist if they want to. The disadvantages? Well, cost, and the unpleasantness of talking about things you may be reluctant to talk about and may have never disclosed to another living soul. Alternatively, if you're seeing a plain old therapist, discuss your sexual concerns with them. If you feel they're just too uptight to do so, check that out for sure, and then consider switching therapists if you're right. Now, these are marvelous interventions that can enhance the quality of life for anyone who uses one or more of them, but many people don't. They're too embarrassed, or they don't want to admit their situation to a partner, or they're afraid it won't help, or they're misinformed about what's involved. So let's take advantage of the many sexual rights and access to sex-related products that we still have. Yeah, while we still have them. Well, I'm Dr. Marty Klein. I drop one of these little videos every few weeks, so if you want to be notified when I do, just click the subscribe button and you'll get pinged. And while you're at it, click the like button, and that'll be nice. I'm Dr. Marty Klein. Thanks for joining me.